Baby boomers and the common pain misconceptions that go along with this generation. Who are baby boomers? This generation was born between 1946 and 1964, making them in the age range between 57 to 75 years old. As this group is an aging group, they are burdened by disease processes and an increased hospital admissions. An article from Generations in 2017 described baby boomers as valuing relationships, resourceful, hardworking, goal-centric, stoic, independent, and typically staying in their own homes. As we see more baby boomers in healthcare settings, it's important to preserve these attributes to have the best health outcomes they can. An article from the Journal of Family Practices published in 2012 gave 4 common pain myths with aging. This was written by 4 doctors and 1 psychiatrist. The first myth starts with pain is a natural part of getting older. There's numerous studies that have failed to find a direct correlation between age and pain. Chronic pain disorders occur actually less frequently in advancing age over 65 years old. The next one is that pain worsens over time. A study done on patients with knee osteoarthritis identified protective factors, including good mental health, self-efficacy, social support, and greater activity, reduce pain-related factors, not age. Next, stoicism leads to pain tolerance. As we know, a characteristic of baby boomers is being stoic. But this does not stop the tolerance, as if anything, pain interferes with sleep and emotions, causing depression and insomnia. More consequences can occur with not treating pain properly. Lastly, prescriptions are highly addictive, which is not true, and this is thought by both baby boomers and by the healthcare system. A study done on older adults who are currently receiving opioid medication for the treatment of chronic pain, only 3% of that results showed behaviors of abuse. So, in healthcare, ageism leads to a lack of communication with this aging population, so baby boomers. As a result, it can reduce elderly awareness, health screenings with the baby boomers, preventative health services, shortages of prescriptions, including pain management, and decreased treatment. These effects came from a study from Nurses' Perception of the Causes of Ageism, which was done in 2020. So, what can we do to stop this ageism and help baby boomers have better pain outcomes? So, for communication, one of the first things we can do is that healthcare workers can have a positive and empathetic attitude towards baby boomers. It is important that we recognize the characteristics of baby boomers and we support their independency and stoic characters. Second, culture building within healthcare. It's important that we raise awareness of these characteristics and of ageism. Once one nurse or healthcare worker knows about the effects and characteristics, it's important to spread it so ageism does not keep occurring in healthcare. Third, implementing communication styles individualized for baby boomers. In an article called The Binding of a Communication Gap Between Generation Y and Baby Boomers, it talked about what baby boomers need as best ways to communicate for them. They like face-to-face interaction, telephone, email, printing out instructions, and learning step-by-step instructions. It's important as a healthcare worker that you know that this is some of the best ways for them to learn and get educated on pain and pain management. Lastly, baby boomer education for advancing communication methods. As we just talked about, they typically use email and telephone. They are not as educated in using messages and different ways of texting. So, as Nate Brogan in his article, Baby Boomers and Millennials Wanting More Frequent Communication, done in 2019, some of the common results that came from baby boomers was that they would like to be sent an email on disease specific info for home management, which is important because we talked about how baby boomers like staying at home. Texting to invite for preventative exams as a reminder in what they need to get done. Because if we prevent the pain before it can worsen, we can decrease chronic pain in baby boomers. Reminders about medications, including instructions and side effects of those medications. It's important that they know about these medications and when to pick them up. So if they are having pain, it's important that they can reduce it as much as they can. And lastly, sending resources on the cost of medications, as well as educating them on Medicare, is important. Some of these medications can be costly, especially to many of these baby boomers are retired. So it's important to have a cost-effective way in communicating this to baby boomers because they may not know. So overall, the healthcare team needs to be assertive and unbiased towards age and understand the characteristics of baby boomers in keeping their independent spirit. Chronic pain is not a normal process of aging adults, and we need to do this, learn through communication, learning cultural awareness, and learning the characteristics, and then building from this and spreading awareness to other healthcare members. Implementing both the baby boomers' current communication styles with new technologies is important and can reduce pain and optimize better pain outcomes for baby boomers.